Hi, this is Healing Talks with Kingdom Docs.
Hi, I'm Dr. Hussein Musa,
I'm Dr. Adatone Musa.
and we're just really happy to continue speaking with you about perspectives in healthcare and how technology is changing modern healthcare.
It is. It's changing. It doesn't have to be scary or a bad thing. We did speak a little bit about chatbots and how they're, I think, a good supplement to getting information on certain disease processes, but you have to always check the sources. They're not always accurate, and it's not the best filter when it comes to past medical history and then tying all of the other information together.
So I think that since the technology is here, it would make sense to figure out how can we use it for our advantage? How can we use it to promote patient healing? How can it make physicians' lives easier? How can it make patients' lives easier?
Oh, there's so many advantages. Once you understand that it's a tool, it's not to be used as a replacement. So as a neurologist, I've been using artificial intelligence for some time, and it's also been part of our medical toolbox for a long time. We use computers, and when I'm seeing a patient suffering from epilepsy, if I think it's appropriate, I'll order or perform something called an electroencephalogram, which is a brainwave test. It looks...
Wow, that sounds cool.
Yeah, it is cool. It's actually been around since the 19th century. It's not new technology, but we have kind of, merged that technology with digital tech and computers. And the very useful thing about it is the computers are able to look over the brain waves and determine if there are high points, low points as far as frequency. It looks at all of these things, and then I can use that with my expertise to come up with a accurate read.
And what's beautiful about this, even with all of her experience at analyzing brainwaves, she still can't figure out what I'm thinking.
I thought it was the other way around, actually. I always know what you're thinking. You don't know what the woman's thinking.
Whatever. I know exactly what I'm doing. Anyway, let's go back to your brain waves.
So with the brainwave test, I do use artificial intelligence quite a bit, especially if a patient needs a very long-term study. If they're going through a 24-hour test or a 72-hour test, it compiles all this information. I always read the study myself, and then I supplement it with what the computer is telling me.
So this seems like a very beneficial use of technology. It looks at the data, it gives you an idea of what's going on, but you also use your own personal expertise gained through years of experience to corroborate what the computer is saying.
You have to corroborate. There needs to be, the reason is the computer makes errors and mistakes, and humans also make errors as well. So to be able to put the two together and eliminate as many errors as possible, that's the goal.
So I like what you're saying, that using this technology as a tool to enhance your ability to read certain studies. And I think even now, using the technology to improve some of our medical algorithms, it's a way to kind of speed up the diagnostic process.
Absolutely.
I do think that if you have enough data points and you create a good algorithm or a good program for this AI to use, it can lead to a reduction of medical errors. It can actually give even a junior physician without as much experience the relative experience of this expert algorithm.
The goal is accuracy and also efficiency. And so you need a combination of human experience, effort, compassion, love, and also all of the technology that we have at our disposal.
Wow, it looks like we're heading into a brave new world.
Yes, we are, but it's exciting.
Well, that's all the time we have today on Healing Talks with Kingdom Docs.
Visit us at kingdomdocs.com for more information.
God bless.
Bye-bye.